Good afternoon, friends. Uh, our today's topic is sexual offenses. All right. Now, I have a simple case, so let's discuss and study the topic along. In case of a alleged kidnapping and gang rape, where three male and one female accused were caught by police based on history of penile penetration by three men with ejaculation, it was discovered that the white stain samples from the crime scene and from the vaginal swabs of victim were from three different males. To differentiate between different semens, all the above techniques are useful. Now, basically, as we all are aware about Barberio's test. Now, it is to make out whether the sample is semen or not, but it cannot identify the source of the semen. That uh, is it from one person or from two persons or three, or from whom is it actually from? Okay, Barberio test simply helps us to make out that this sample is semen and not other, not anything else. Okay, in order to differentiate between different semens, the techniques that are available to us at hand are DNA amplification techniques like PCR, Y chromosome short tandem repeat marker, and single photon fluorimetry. All right. Second thing in this is we can talk about MTP Act. Uh, MTP Act. Now, usually there is opinion of two doctor is needed for about 20 to 24 weeks pregnancy, while one doctor opinion is needed up to 20 weeks. Okay. Now, MTP Act salient features with indication. Now, in case of pregnancy, which is up to 20 weeks, there are two indications basically. First, if there is serious risk to the fetus or to the mother, or if pregnancy is caused by contraceptive failure, either by a female or by the male or by any of the partner. All right. Now, in such cases of pregnancy up to 20 weeks, one doctor opinion is fine. All right. But pregnancies which are exceeding uh, between 20 to 24 weeks, two doctors' opinion is required. Now, once the pregnancy exceeds the duration of 20 weeks, two doctor opinion is required. It is mandatory, and there are multiple indications for that. Serious risk to the mother, serious risk to the fetus, pregnancy caused by rape, incest, or any sexual assault, or pregnancy in a minor, insane, physically disabled, if change in marital status during the course of pregnancy. For example, husband died at the pregnancy of about 21 weeks of the female. Okay, now the female does not want the child. Okay, so she can get the MTP done, but now at the pregnancy of 21 weeks, opinion of two doctors will be required. All right, but if the pregnancy is caused by contraceptive failure, it is admissible only up to 20 weeks according to the MTP Act. Now, someone who is more than 24 weeks pregnancy, MTP can be done at the present age at any time of gestation. Required that there is only one valid indication for it, that is when there is a serious risk to the fetus. This has been written very seriously or very sternly uh, in our acts, that any substantial fetal abnormality, for example anencephaly, okay, then only uh, MTP is allowed at a pregnancy of more than 24 weeks. All right. Now, in such conditions, we need a member of medical board. We need, it is done basically under the permission of medical board, which usually consists of an obs and gynae, a pediatric doctor, a radiologist, or a sonologist, or any other member can be added by the court or the government side from time to time. All right. Now, if you are asked about pregnancy termination according to MTP Act 2021, is up to now. What will you mark? 20 weeks, 24 weeks, 26 weeks, 28 weeks. Now, if these are the options, best answer would be 28 weeks because there is no upper limit defined. All right. But if it is mentioned at any age, that would be the best answer. Okay. Now we come on to certain sexual perversions. Uh, first, first word to bring into consideration is masochism. All right. Now it is basically a sexual pleasure which is obtained by getting hurt by the opposite sex. Now here, let me explain in a very simple language. Uh, she is getting the pain, and he is getting the pleasure. Okay. So here, it is masochism. All right. While there is another term where pleasure to one who is hitting, okay, that is sadism. Let me explain it once again. In the first scenario, मजा किसे आ रहा है? The one who is getting the pain. Okay, one who is getting the pain, जो मार खा रहा है उसे मजा आ रहा है. That is, she is getting the pain and he is getting the pleasure. Okay, opposite sex is hurting him herself, and he's getting the pleasure. All right. While in the other condition, the male is getting pleasure by hitting someone. Okay, that is sadism. It's simply a game of English language, so do it very cautiously. Now, next term is person sitting naked in balcony. Okay, displaying of the private parts. That is exhibitionism. Okay, it is punishable under 294 IPC, and under it we also have frotteurism, which is covered under 290 IPC, which is rubbing of sexual parts in public. Then there is another term, eonism, which is cross dress. Male is getting sexual pleasure by wearing sari or petticoat or any kind of female clothes. All right, it's a gender identity disorder. Then we have excessive sexual desire in males, that is satirism, and in females it is called as nymphomania. Then we have another term which is voyeurism. It is also called as scotophilia, watching or capturing private movements of a female. All right. It's not male, it's not both, it's actually about the female. That is why it is considered to be gender biased, and it is punishable under 354 C IPC. Then we have, now outraging the modesty of a female is punishable under 354 and 509. Now, what do we have in 354 and what do we have in 509? Just have a look to that. All right. Now, 354, it says use of force to outrage the modesty. Okay. While 509 says use of words to outrage the modesty of a female. All right. Now, when we use the term use of force to outrage the modesty, it is called as sexual assault. While use of words to outrage the modesty is called as sexual insult. Okay. Now, let's go a little more deeper. In 354A, we have sexually harassing a female. Okay, here we are talking about the harassment of a female. And in 354B, any sexual assault to disrobe a female, to undress a female. Now, it does not mean to remove all the clothes. Even unbuttoning one or two button is an act of disobeying a female. Okay. 354C covers voyeurism, which was basically watching or capturing private movements of a female, and 354D is about stalking a female. Now, the next topic is, let's take it by an example. A 15 years old girl comes to an AIMS OPD with her mother. Okay, now since they have come to the hospital, they might not have come to visit the doctor or to see the doctor. They might be having some pain or an injury. That is why they have visited the doctor. All right. And then they give a history of penovaginal penetration by a neighbor. Doctor says, let me examine the genitalias, but they refuse to consent for a medical examination. Okay. Now, in this case, patient may consent or may not consent for the medical examination. You should call the police. Okay. Now, if the patient is not consenting, as a doctor, we should counsel the victim and the guardians. Even after psychological counseling, if they are not agreeing for the examination, take a written statement from the victim and get it signed by the victim that you are not willing to get the examination done, and you have been explained everything about the pros and cons of the examination, and this is called as informed refusal. Okay. Just the same way as we take informed consent in such cases, we we have all rights to take the informed refusal as well. All right. Now, if the patient is not allowing you for examination, but they have got made an OPD card. Now, making an OPD card, it gives us an implied consent for the treatment, investigation, and the diagnostic tests. So, doctor can get necessary tests and treatments to be done. Okay. Now, what all diagnostic tests you can get done in such cases? Rule out any kind of STDs if accused might be suffering from HIV, syphilis, etc., and rule out pregnancy. Now, suppose pregnancy may be of 22 weeks. Can MTB can be done in such cases of rapes? Yeah. Yes, as pregnancy due to rape, incest, MTP can be done till 20 to 24 weeks under the opinion of two doctors. Now, if the victim gets ready for the examination, whose consent will you take? In case of a victim who is of the age of more than 12 years, we will take the consent of the victim, okay, because she is eligible to give the consent if she is more than 12 years of age. But if she is of the age less than 12 years, and if victim is unable to understand the situation, then the consent of the guardian can be taken. Now, after the consent was taken, you examine the genitalias. You suspect tears of the hymen. Okay. Now, at which part of the hymen will you look for the tears? Okay. 11 o'clock, 1 o'clock, 5 o'clock, 7 o'clock. Now, based on the penovaginal penetration, tears reach the margin of the interoitus and they should be present between 5 to 7 o'clock position. Most commonly posterolaterally, because vagina has very weaker support posterolaterally. Understand? Now, if you find tears in the anterior area, that is suggestive of either the foreign body has been inserted, it could be a wooden rod or an iron rod which could have been inserted into the vagina, and secondly, it could be also because of finger penetration. Now, in case of rape of small children's, hymen is usually it is not ruptured as it is very deeply situated. And next question is use of toluidine dye. Now, this is basically to identify micro-size injuries, lacerations of the genitalia, to rule out margins are clean cut or they are irregular. Now, instruments which are used to examine the hymen or its tears is known as GK rod. It's basically, we describe in the way like it helps to understand the GK of the hymen. Okay, it is called as Gleister Keen rod. Now, the genital swabs, they can be preserved up to 4 days, that is about 96 hours. While the medical records, if it is demanded by the patient, the nursing room or the doctor should provide it within 3 days. Okay. Ideally, the medical records are preserved uh, for the IPD patients for about 3 years. Unknown tag is given to a dead body of a dead body if it is not identified within 2 days. Okay. Nowadays, identification has become very simple, very easy, as the doctor will bring the biometric machine and put the fingerprints of the person. Each one have Aadhaar card, which takes into account all 10 fingerprints, iris scan, and facial photo. Okay. Now, what to be done if no epidermal ridges in the person? Then you will have to think of two things. Firstly, there is permanent loss of fingerprints, which could be because of either leprosy or it could be also because of electric and radiational burns. Now, there could be another scenario. Patterns are retained, but there is change in distance between the ridges in the fingerprints. Now, it could be because of AIR, which is acromegaly, infantile paralysis, R for rickets. Now, there could be another scenario as well. There could be complete loss of complete ridges, or there could be complete ridge atrophy. That could be because of celiac disease. Then there could be incomplete ridge atrophy, which could be because of dermatitis. There could be ridges alteration, which happens in scleroderma, acanthosis nigricans, skin eczema, and atrophy. All right. There could also be certain genetic disorders where no epidermal ridges are developed, no fingerprints at all. Okay, such person can be called as inborn criminal. All right. Now, such conditions are Baird syndrome, which is BAIRD syndrome, adermatoglyphia, NFJ syndrome, JCE syndrome. Now, the last question to be taken into account is what are the diseases which are covered in Rashtriya Bal Swasthya Karyakram? Now, it basically has 4Ds. Why we are discussing it right here? Because in the last lecture, we discussed about the 4Ds of negligence. All right. So that is why we are studying the 4Ds here as well. Okay. Now, these 4Ds are basically dealing with defects at birth, deficiencies, disease of childhood, and developmental delays. And apart from that, there are certain other conditions which are kept in the optional area. All right. Now, what are covered in defects at birth? It covers various birth defects like neural tube defect, Down syndrome, cleft lip or palate, talpies, which is club foot, or congenital cataract, congenital deafness, or congenital heart disease. Okay, deficiencies. Now, in this, we have covered deficiency of vitamin A, vitamin D, severe acute malnutrition, goiter, anemia, especially severe anemia, then disease of childhood. Most importantly, we have covered in it rheumatic heart disease and convulsive disorders. Then we have developmental delays and disabilities and impairments. Basically, it covers vision impairment, hearing impairment, neuromotor impairments, motor delays, cognitive delays, behavioral diseases like autism, ADHD, learning disorders. And lastly, it covers congenital hypothyroidism, sickle cell anemia, beta thalassemia. These are basically in the optional condition. All right. So that's all for today. Hope to come with a better content tomorrow. Thank you. If you like the lecture, kindly subscribe to my channel and share the video. Thank you.